Great.
So here we are.
Here we are. Hi, everybody. It's Janice here from the Bridges Society. I'm with my friend Dave McKay from Common Connection, from CN Rail, from Teamsters Jasper 898.
You bet.
And fellow mental health enthusiast. And we're here because it's September 10th, which is the National Day for Suicide Prevention. And we wanted to spread the word about the resources that are available to help folks experiencing poor mental health. And the first foremost resource that is fairly new and not everybody might know about it is the new suicide prevention crisis line, which is 988. So close to 911, but it's easy to dial. And you want to call this number if you're thinking about suicide, or even if you have a friend that you're worried about and you want to know how to help them, right? You can call them and they will help you with that. But also we wanted to talk about the Hinton, Town of Hinton website, hinton.ca, has a resource page called Hinton Offers Wellness, which is, you'll find many of the resources that are locally available to people who are looking to improve their mental health, including local organizations who provide services or can help you navigate those services. Such as Hinton Addictions and Mental Health Office in the Civic Center, or Bighorn Primary Care Network down in the Valley Shopping District, all the way to additional support and education organizations such as the Bridges Society and Hinton Employment and Learning Place. So if you go to the Town of Hinton website, which is hinton.ca, and you search Hinton Offers Wellness, you will find all kinds of resources there. There's you'll find the contacts for the emergency shelter or for the food bank, all kinds of services that will, the reception of these services will help you with mental health as well, because mental health is a complex thing. We all experience mental health.
Absolutely.
And it's a spectrum, it's a continuum. Sometimes it's good, sometimes it's bad, whether you have a diagnosis or not. So it's important to know what's out there to help you wherever you're at on your mental health journey. Now, what we also know is men are 3 times more likely to die by suicide than women are. And men in certain jobs, especially, are at much higher risk for things like depression and addictions, and certainly financial stressors, all kinds of things that contribute to those suicide rates.
Those jobs, the jobs that are really hours change, doing these graveyards, the night shifts, the day shifts, that really takes a beating on your brain, on your mental health.
Absolutely. And the traditional cultures of those workplaces too have a lot to play into how we treat our mental health.
That's right.
As workers and as co-workers, and how we treat our peers too, right? Dave, I know this is a passion item for you, and I know that you've done a lot of work over the last couple of years with your workplace. I want you to tell me about Common Connections.
Well, it's Common Connections. It was started after we lost one of our friends, another co-worker, and it happens way too often, and the resources weren't quite there in place where he didn't think he could reach out. So we've built this program, and my team has done absolutely wonderful with it, to where we've had help from Jasper Teams Society, and they come in and they will teach us reading the signs and symptoms and stuff like that, how to use local resources like yourself, like Bridges. The Bridges Society is an amazing help support, and these are the kind of places that we need to start kind of promoting. And that's what we do now, is we train people in mental health first aid. We have 10% of our workforce is volunteers. And it's Elsa's birthday, so don't mind her. And so 10% of our workplace is volunteers that are we're co-workers, and we're just there. We're there just to help. It's volunteer basis, and they get trained in mental health first aid.
It's a very valuable learning program. I gotta say, I'm a big advocate for mental health first aid. If you work with people, if you like people, Like, you're never going to go wrong taking this training if you have access to it.
Yeah.
It makes you a better friend, and it certainly makes you better equipped to help people. How often has somebody asked you, like, confided in you, and you like, I do not know how to deal with this, or what to say, you know?
Absolutely.
And so,
and we still don't, right? Because
many
you're
times.
still learning. We're
Sure.
still learning all the aspects of mental health because there's so much to it.
Yeah, for sure.
You know, and being in a male dominated, we have a lot of females there too that go through their own struggle. You know, and it is a struggle.
And
so
they
we're
might
there.
not, they might not feel that their workplace, and typically our workplaces have not been safe places for us to reach out to our peers, right?
That's right.
And
so
that's tough.
we want to create a place where people are welcome to just talk to us.
Yeah.
Talk to us. We can guide you to local resources, whether it's addiction, whether it's mental health, or just depression, stuff like that. Because everything affects everybody differently.
Yeah.
And there's an old saying that somebody once asked me, how many times have guys gone to work and thought about just turning the wheel?
Yeah.
And 9 times out of 10, people will say, if they were being honest with you, you thought you're not going to do it, but the thought has been there.
Yeah.
And that's where
alarming.
a talk needs to happen.
Sure.
And that's including myself, where I've had my own issues, and this is where this program has helped myself even.
Yeah.
And I'm not afraid to admit that
Right.
this program and my team have helped me grow and navigate through my own life. And it's amazing to see all the support networks that are coming out. And Heads Up Guys, there's another great
So
website.
this actually leads us into what? So with the rural mental health, oh my goodness,
Hey.
birthday barks. Our Hinton Rural Mental Health Network Action Team has focused our project this year fully on men's mental health, spreading awareness of the risks, the higher risks for suicide among men, but also to highlight the resources, like the work that has already been done and is already being done by other organizations, like the Center for Suicide Prevention has the Buddy Up program, and we've been promoting this all year.
It's a great program.
How to teach men, or to encourage men to change the environment of their friendships and be that safe person that somebody can talk to.
Sorry.
Because how do you find a friend, or how do you create this safe space to have those vulnerable conversations with your friends? You be that guy who says, hey, I'm concerned, I'm noticing you're not sleeping well, or you're drinking a lot lately, or you've been late for work a lot. Like, what, are you okay? Let's talk about this. Because those are the kinds of invitations that are going to change our workplace cultures, that are going to change the relationships between men, and how they, whether or not they dismiss those vulnerabilities, which they tend to do traditionally. And so hopefully we can move the needle on that. BuddyUp.ca, they have a big initiative every June, right, with the Buddy Up Challenge. But we've been pushing this stuff all summer, all year. And HeadsUpGuys.ca
wonderful
or
website,
.org has a really great resource, self-assessments for anxiety, depression, toolkits.
You can talk to people.
There's some really great stuff out there.
Yeah, and those are just regular people. You're
That's
talking to regular people.
Absolutely.
That are just, everybody has an issue. People have issues. You're not the only one.
That's right.
You're not the only one. And, when you think of it,
and
stuff that you've thought about, everybody, there are other people who've thought the same.
That's right. And the thing is, there's a lot of stigma around being vulnerable as a man, or sharing that vulnerability. I should be able to shoulder these problems myself. Well, you know what? Those problems are pretty hella big.
That's
right.
Absolutely.
And I mean, like, why should we shoulder them ourselves?
Yeah.
We have community, we build community, and we have family and friends for a reason. Like, let's make this stigma go away. Let's make these kinds of conversations commonplace, welcoming, friendly, and safe to have with each other.
And companies should be right on board with stuff
Absolutely.
like this.
Like not just one workplace. Like,
That's right.
I would really love to see all of the workplaces developing cultures that are really amenable, not just developing, but like proactively installing ways for this to happen in all of our workplaces.
That's right.
And so, that's one of the goals of the Rural Mental Health Network. And if you work in a in HR or safety in some of the workplaces around town, you might have already heard a phone call from me, so that we can find a way to share the resources that we've pooled together with you, so that you can have them in your workplaces.
And things that open up too, like with all of this opening up, it's really great to see. Like you'd be glad to know, like Teamsters Rail, they put out a thing right in their bylaws that they will now advocate for mental health right to the government. And this is great for breaking that stigma. Absolutely. Because it needs to come down.
Well, and I mean, even from a company standpoint, I'm sorry, but mental health is an OH&S issue.
Yes, absolutely.
Poor psychological health affects workplace atmosphere and culture. It impacts safety. It impacts productivity. Healthy workforce means a healthy company.
That's right.
Healthy profits, right?
That's right.
And healthy customer relations.
Yeah.
So we're gonna wrap up here, but I wanted everybody to know that so in addition to all of this promotional work that we've been doing all year, the Rural Mental Health Network is really pleased and so excited about our signature event happening next week, Tuesday, September 17th. Tyler Smith, Hinton alum, he's awesome, former Humboldt Bronco hockey player, bus crash survivor, amazing race winner, and inspirational speaker, is going to be coming to Hinton on Tuesday the 17th. He'll be speaking at the Performing Arts Theatre of Hinton. Unfortunately, the free tickets to see that event live at the theatre are all sold out. But the wonderful thing of our technology is we have actually 3 additional locations where audiences can gather and watch the event live. So if you couldn't get a ticket to the live event at the theater, you can come and watch it live streamed at Bridges on the evening of, including participating Q&A after. We'll have all of the swag and resources at each location. So the 3 locations are the Bridges Society here at 250 Hardesty Ave, also at Pine Valley Lodge down on Bhutan Avenue. And for our youth community members, the Hinton Youth Center will also be hosting for kids to go and watch from their location. And again, you'll be able to ask, participate in the Q&A through the local facilitator at each event. We'll be able to text in your questions and hopefully participate in that. And we hope to see as many people get a chance to see Tyler as possible. We're really excited with the rate at which we sold out these tickets. People are really excited to hear Tyler speak. I don't know if you've seen his video that he put on social media.
No.
That it was like, "Hey Hinton, I'm coming home. I can't wait to talk to you." It was really exciting.
That's awesome.
Just really, it gave me goosebumps.
I watched him on Amazing Race, so yeah.
Oh, it gave me goosebumps. I'm really excited to be able to participate in this. I hope we see you at one of the events, and if not, just come on down to Bridges anytime. And we'd love to share these resources with you, talk to you about what we're doing in the community with the Rural Mental Health Network, as well as what Bridges does in the community to help you improve your mental wellness through connection with community and participation in community and belonging. So thanks for having coffee or tea with me today.
Thank you.
Happy birthday, Dave. It's Dave's birthday.
As well as my dog.
As well as his dog, Alice's birthday. Thanks for coming and hanging out with me today and visiting, and I hope I see you on Tuesday.
You betcha.
All right.
Sounds good.
Take care, everybody.
Thank you.